Hi everyone, welcome to JOANTalks, and I'm your host, Joan Liu. My goal for this podcast is to focus on putting together the knowledge and science relating to your health, fitness, and nutrition that is easily understood and accessible by everyone. Without further delay, this is today's episode. Hi, welcome back to JOANTalks. Today's episode is the second of the two-part series on blood pressure. In the previous episode, I have explained about what is blood pressure, why should we care at all, about the numbers, what else does high blood pressure affect beyond heart disease, how do we measure our own blood pressure accurately, what do we know about the variations in blood pressure through the day. We also looked at the revised classes of blood pressure readings, and now we know that we have to stay within the normal range. We should be at or below the systolic number at 120 and a diastolic number at 80. We explored the factors that affect blood pressure readings and what you should do to get the most accurate reading possible. Today, I have included a graph that summarizes the factors that affect blood pressure readings, and I will include the graph in the description box of my YouTube channel. For those of you who have just joined me today, you may check out the previous episode, which was the first part of the series on blood pressure. Blood pressure is defined by the American Heart Association as the force of your blood pushing against the walls of your blood vessels. If the pressure is high, it puts a strain on the blood vessels and the heart, which can cause both of them to weaken and work less efficiently over time. The chronic pressure on the vessel walls causes harm to the delicate tissue covering the arteries in the presence of the LDL cholesterol. Plaque forms within these areas of injury, and that leads to atherosclerosis. Atherosclerosis is the process through which fatty buildup occurs on the inner lining of the arteries, and the arteries get weakened and become less flexible, and they may narrow, allowing less oxygenated blood through the body. This increases the risk of ischemic stroke in the brain. Hypertension may also lead to heart failure, and is a condition that can occur over several years. The narrowing of arteries associated with high blood pressure causes the heart to work harder, and these two adaptations make the heart less efficient. High blood pressure is associated with memory loss and dementia from these narrowed and blocked arteries. Now let's look at exercise and blood pressure. When you exercise, your blood pressure naturally rises. Generally, such increase is not associated with negative health outcomes. Your systolic and diastolic blood pressure can be expected to drop an average of 5 to 7 millimeters of mercury among adults with hypertension with regular aerobic exercise, and the reductions can even be greater for those with a higher starting baseline blood pressure. And these changes can happen immediately after exercise, lasting up to 22 hours. The idea is we would want to have this occurring over time, turning this acute change to chronic change. Even modest reductions in blood pressure for those with very high levels can provide substantial benefits. Now, I'm sure many of you have questions in your mind now, and I will address some of the most common questions here. First, how much exercise is needed to see improvement in the blood pressure? You will be happy to know that you can, in fact, reap the benefits after a single bout of exercise. Exercise offers positive stress in the arteries, which stimulates the cells to release nitric oxide. This molecule helps in the dilation, which can remain effective up to 24 hours after exercise bout is completed. Regular exercise causes a reduction in resting blood pressure along with many other positive changes in the body. The guidelines from the American College of Sports Medicine, that is the ACSM, recommends moderate intensity aerobic training 5 to 7 days per week and 2 to 3 times of resistance training per week to achieve maximal benefits for those with hypertension. However, ACSM still recommends exercising on most days, if not daily, of the week, simply because of the favorable effects of lowering the blood pressure. Next common question: how hard should you exercise to see improvements in your blood pressure? Even light to moderate regular exercise can improve the blood pressure, with moderate intensity exercise defined by exercising at 40 to 59% of your heart rate reserve. If you can, use a heart rate monitor, as it can help you assess the intensity. There are formulas that helps you to calculate your maximum heart rate, and the heart rate reserve is another way to measure, since exercise intensity may be gauged incorrectly when you are just going with how you feel. One of the equations used to predict the maximum heart rate is the Gelish et.al, and that's given by 207 minus 0.7 times your age. The equation with an example will be given in the description box on my YouTube channel, so please refer to that. So the next common question is, what kinds of exercise will be helpful for people with hypertension? Any kinds of exercise will benefit, but the greatest reduction in blood pressure is associated with aerobic exercise, and the ACSM recommends resistance training at moderate intensity at 60 to 70% of your 1 rep max. For older individuals or beginners, try to perform exercises with lighter weights, around 40 to 50% of your 1 rep max, with more dynamic movements, and make sure you breathe regularly throughout all your activities. But please, I would recommend to consult an experienced trainer to guide you through your exercises. Another common question would be, how long should you be exercising for? The guidelines suggests that those with hypertension should exercise on most and preferably every day of the week, with an accumulation of 90 to 150 minutes per week. This may be done with a combination of aerobic and resistance exercise. You may perform continuous or accumulated bouts of activity. For example, 10 minutes in the morning, 10 minutes in the afternoon, and 10 minutes in the evening, and still see benefit to your blood pressure levels. Okay, other question would be, what other options are there for those with hypertension? Yeah, of course. Definitely a healthy eating plan together with regular exercise will lead to positive outcomes on your blood pressure control. But of course, there will be some individuals who may require additional antihypertensive therapy treatment to achieve and or maintain optimal blood pressure control. Now, if medication is really required, it should not be replacing a healthy diet, nor should medication be a substitute for regular exercise. Instead, if necessary, medication should be included in the plan of action for blood pressure management. So please consult your physician. Now, we have come to the end of the episode, and I hope you found this information useful. Please share with someone whom you know will benefit from this. If this is the first time you're listening in this podcast, JOANTalks is all about health, fitness, and nutrition. If you're not a subscriber yet, I would appreciate if you do so. The podcast is available on all podcast platforms and also on my YouTube channel. I'll see you in my next episode. Bye.